Hello, everybody. Coming to you, of course, from the very beautiful Maldives Island. Um, Getting requests to get to discuss a few topics of interest in obstetrics and gynecology, and today we would like to tackle infertility. So, what exactly is infertility? So, infertility is the inability of a couple who have been trying to get pregnant for a period of at least 1 year if they are younger than 35 years, or less than 6 months if they're less than 35 years. And by trying, we mean at least they are active to at least 3 times per week, meaning that there is adequate chances of sperm to be available throughout, so that in case these ovulation, that the egg is fertilized. Now, if it takes more than 6 months to 1 year, as per that description, then we say that most of the cases, or most of the couples should have conceived by that time, and therefore we identify that this could be indeed an issue. Now, what are things we can do before we get to come in to see the doctor? So, number one, of course, general health is very important. We talk about just mental health. So, infertility is known to be a very trying ordeal for not only the couple but just the society at large. So, having questions around kwani hamjui kufanya mapenzi ndio maana mpati watoto, to it's you don't know positions to be able to conceive, or is it that you are too lazy in bed? Is it that the penis is short? So we hear all these different almost derogatory comments that are directed at a couple who are struggling with infertility. So the first thing becomes just that mental well-being, just getting to know that it takes time. People are different. There's people who will get pregnant without trying, and there's those ones who, after months and months and months of trying, is when they'll be able to conceive. So everyone has a different pace at which they will need to get to take before they get to conceive. Now, after mental health, they come to physical health. So the physical health, we talk about your BMI and how close to your normal BMI you should be. So your weight for height should be ideal. So overweight and obese people may, and I say may, have a bit of more struggles in terms of fertility. Not all the time. Some cultures, of course, have physical differences where there's more body weight. You have, as we say, your bones are heavy, so that is normal, and we take it case by case. Now, the other part, of course, becomes in terms of feeding, that eating healthy, reducing your pro-inflammatory foods, your excess sugars, and excess, the fried foods, then becomes important to just gaining this general health. Exercise, on the other hand, so just keeping moving. We are now, as a society, becoming more and more sedentary, because there's car keys in your pocket, there's a boda outside, you have an Uber app on your phone, and Bolt little, you have a friend who's able to carry you down to where you're going to. So there's less and less incentives to actually wake up and walk. And we talk about just trying to have a society that is more physically active, just even for general health. Talking about reducing your cholesterol levels, increasing your muscle strength through muscle training. There is through just getting your cardio in, that reduces your risk of heart attacks. There is just helping to improve your metabolism, therefore weight management is better overall. So all these are very important in trying to just be generally healthy, even as you are managing your fertility. Now, when the 6 months to 1 year gets there, then, and yet we're not able to conceive, then there is the role of course, your folic acid. We say initially Our public health initiatives have incorporated folic acid in the ugali. Our Raha Premium has folic acid in it. We have it in your blue band, and so in our general maize meals, and you'll find it in, and among other things, and that's supposed to help to reduce. The role of folic acid is reducing your risk of miscarriages and the congenital malformations, but in at the point that it's taking you longer, then you may need to supplement externally with your folic acid. Now, as you do that, and again, still it's not happening, that's where you get to visit your gynecologist or your general doctor initially. So, the general doctor may be able to first identify what is going on, and then we work usually on an escalation program. So, if you are, if what is accessible to you would be a general practitioner, then you get to see a general practitioner. They can do preliminary tests to sort of find out what's going on. That would be from your ultrasounds. Do we have an issue anatomically on your uterus, on your do you have fibroids? Do we look to have a big ovarian cyst? Do you have hormonal imbalance? Is your menstrual cycle out of sync? So all those become important to look out for. Then, in case there's an issue, then they can get to escalate it to the next level. Now, after getting to visit the general practitioner or the gynecologist, and the issues are not able to be addressed at that point, then we go to the next level, where now we come into fertility specialists like ourselves, and what we do is look at the fertility aspects from a from aerial view, where you're looking to see hormones out of sync for both the man and the woman. Generally, we say 30% of infertility is male factor, 30% female, 30% is combined, which means there's an aspect of the male and an aspect of the female that is stopping fertility from being able to be achieved. And also there's a 10% where we say is unknown. Unknown means that we cannot identify an issue that could be stopping you from conceiving, but then there's things we can do to be able to rectify that. So when we look at the hormone aspect, we look at the anatomy for both the man and the woman. We look at the fallopian tubes, are those open or closed. We look at the semen to see if the semen, the quality and the quantity is okay. So through all this, we get to sit down and understand more clearly what your fertility issues are and how best to remedy it. Some may be just as simple as managing your hormones and you are back to fertility. Some may be requiring surgery to open the tubes. Some may require you to sort of do a combination of both surgery and other management. For example, use like your endocrinologist or other doctors to balance, maybe a gland issue, a thyroid issue. So once we identify, we're able to work with other specialists if need be to be able to rectify your body functions and get you back to fertility, to being fertile as soon as possible. Now that can happen naturally, whereby once we correct it, then we give you a period of time, and within that time we expect that we follow you up and see if something has happened. That usually comes if there is no, we give you at least, if there's no major issue, usually we give you after interventions about 3 to 6 months. If that has not resulted in a pregnancy, we ask you, so you'd come in and I'd ask you to come back again. We change. Fool is the only person who does the same thing expecting different results. So we change tacts to a different mode. For example, now from natural conception, now we give you medication to improve the quality of the egg, the quality of the sperm, the timing of ovulation, timing of intercourse, etc. Then from there we give you another 3 months or so and see how that goes. Then reassess. If that doesn't, then we escalate. You can go to intrauterine insemination, which we'll be talking about in a separate video. And we try that again for about 3 or 4 cycles. And if that doesn't work, we escalate to IVF. The
IVF can be where you're using your own egg and sperm. This is the egg and sperm of the couple. There can be situations where we need to use a donor egg. There are situations we need to use a donor sperm, and depending on what the causes or the issues are in regards to fertility. So this is the basics around fertility. Just wanted to touch on that, and of course we'll be getting your questions around it, trying to answer and helping you towards your journey for fertility and the desiring children. And God bless, all the best, and enjoy the views as a part. Bye bye.